Hello everyone. Today we're going to talk about another fat soluble vitamin which is very high yield for your exam. And the reason why it's high yield is because, for one, we need it. It's a fat soluble vitamin. Did I say I'm talking about vitamin D? Yes, so we're talking about vitamin D. It's fat soluble vitamin. It's high yield because it is required for normal balance of calcium in our body, and we need calcium for bone mineralization, and we also need calcium for normal functioning of almost any cell in our body, in skeletal muscles particularly. So now looking at vitamin D, how do we get vitamin D? We as humans have the ability to synthesize our own vitamin D from cholesterol. Once the cholesterol in our skin is exposed to UV light from sun, we're able to convert the cholesterol into an inactive form of vitamin D, which is subsequently converted to active form of vitamin D. But many of us are vitamin D deficient because we could come from cold climate, we could come from an area where there's not a lot of sunshine, or there are a lot of people that avoid sunshine for many reasons. That leads to vitamin D deficiency. Vitamin D, the ingested form of vitamin D, or the vitamin D that we form in our skin, is the inactive form of vitamin D, which is called cholecalciferol, right, which is inactive form. And that vitamin, inactive form vitamin, requires two of your organs to be functioning normally in order for the vitamin D to become activated, where we could utilize it to perform our body function. So first activation is done in the liver, where there's a 25 hydroxylation of vitamin D, which is the first activation, but vitamin D is still not active. So at this point, at 25th location, you hydroxylated it. So it goes out to show you that you need to have normal liver function to carry on the first step. The second step of vitamin, so once that 25 hydroxylation is done of the vitamin D, at that point vitamin D is your 25 cholecalciferol, and it stays in the liver, stored form. So when your calcium level goes down, that's when your parathyroid hormone, which is located behind your thyroid gland, is stimulated, which secretes your parathyroid hormone. And parathyroid hormone comes to your kidneys, and it activates another enzyme, which is another hydroxylase enzyme, which adds another hydroxyl group to your vitamin D, converting it to 125 dihydroxycholecalciferol, which is the active form of your vitamin D. So going back, you need to have liver intact, and you also need to have your kidneys intact in order for activation of vitamin D. So let's say for whatever reason somebody's liver wasn't functioning, then obviously they will not be able to carry out the first hydroxylation of your vitamin D, and if kidneys were not functioning, they will not be able to carry out the second hydroxylation of your vitamin D. Therefore, you need to have both organs intact to function for the activation of vitamin D. So once both of those organs are functioning normally, so your 125 hydroxycholecalciferol is in the kidneys, and then it goes into your gut, and it is in the duodenum where your vitamin D, active vitamin D, works to reabsorb your calcium. If your kidneys were not functioning, liver were not functioning, then you will not be able to take the regular D3 or cholecalciferol as your supplement. You will need to have an intramuscular injection form of activated vitamin D, which obviously pharmaceutical companies must take, full advantage of sick people, which is a very expensive form of vitamin D. And of course, when you don't have vitamin D, you have bone deformities. Then you also have, what's the condition called? You have muscle abnormalities, where you feel fatigue and all kinds of stuff, because it's all related to calcium. So it is a very high yield topic, and you need to be able to know what activates the absorption of vitamin D, how the vitamin D functions, and where it absorbs the calcium and where it gets activated. All right, subsequently we'll talk about what happens with the deficiency of vitamin D. Thank you.